Well, hey everyone, I am here with our president, Mr. Mike Smith, to talk to you about a very timely topic today, and that is about the Notice of Benefits and Payments parameters from CMS regarding healthcare.gov and marketplace plans. So there's been a few changes that we want you all to know about, so we brought Mike in today to go over that with you. So first of all, Mike, this went into effect June 18th, right? And first off, what is the motive behind this? What's CMS trying to accomplish?
Well, in a nutshell, we have a problem, and when there's a problem, CMS creates new regulations. In this case, the problem, as many of our listeners will identify with, is the agent of record changing that happens. It's very simple for someone to go on to an electronic data exchange platform and enter minimal information that will identify who the current enrollee may be, and an agent is able to switch them from company A to company B, which in essence results in the agent of record being switched. And so because of that, there have been a lot of complaints to Medicare. And thankfully, there's now some direction from CMS on how we're able to help protect our marketing partners when they go out and spend their time, effort, and energy to write a case through the Affordable Care Act. We'll now be able to better protect their book of business and help them to grow their business instead of just trying to chase down and retain what they have.
Yeah, I don't know if you listeners have heard about that happening before, but some agents have reported that in their Health Sherpa dashboard, from 1 month to the next, someone's missing. Their plan didn't even change, just the AOR, because somebody was able to just go right in and make the change without consent. So that's what they're trying to solve. The solution is still kind of subject to interpretation, shall we say, a little bit?
It's true. We're still seeking additional guidance from CMS, but for the most part, I'd say that the rules are baked into what agents and brokers need to start learning and also implementing as a common business practice effective now I'd say for at least July 1st, 2023 effective dates going forward. Now, some of our listeners also write Medicare Advantage and prescription drug plans, and they can relate to the regulations that are out there, especially as they relate to a scope of appointment. So, as you mentioned, the Notice of Benefit and Payment Parameters 2024, that's this set of regulations for the upcoming year. It doesn't mean that this is the first set of regulations in the ACA. It just means that for the last 10 years or so, we've been able to go by with a rather compliant, not over-regulated environment. But now that these problems have begun to surface, CMS felt the need to step up, which I support because obviously we want to protect our agents' book of business. So within the NBPP, there were several other parameters, and I just want to touch on a few of those real quick, and then I'd like to get more into the actual disclosure and consent form. Of course, we've already posted this on our website, and people will also find other regulations as I'm about to explain. But in a nutshell, a couple of things that the NBPP did, all very good for our business, by the way. We know that this is an HMO market primarily. For example, in Texas, it's only an HMO market, and that alone is a concern because a lot of times specialists are not in the network, and there have been network adequacy standards that have been around since the ACA was passed, but they've not really been enforced. What the NBPP 2024 does is it sort of addresses that, gives a little more teeth in the bite regarding how carriers are supposed to provide network adequacy within a certain primary marketing area. So without getting into the weeds on that is something that's on the radar and will certainly get more attention. The other thing that I find very interesting and I think from a consumer standpoint is going to be very helpful is to simplify the choices. There's just simply too many choices. You go in, plug in a Dallas-Fort Worth zip code, and it's not 40 or 50 choices, it's 70 choices. Well, it's great to have all those choices, but the problem is one silver plan to the next has such minor modifications that it's almost too many choices, and to simplify that process isn't going to mean that we're taking things away from people. It just means we're going to help them focus. And in today's world, it's good to have a little bit of focus.
Yep.
So standard plans to non-standard plan ratios are going to change. Plan ratios in 2024 for the standard plans, the carriers will be able to offer up to 4 choices. So that might make some of our listeners sit back and think about, wow, what's going to happen to my existing book of business? Great question, because some of those plans might be rerouted, and therefore if they have, let's say, a silver plan A, and now it has to be moved over to a silver plan B because silver plan A is no longer going to be available, that doesn't necessarily mean the agent is going to have to rewrite the case. There's a mapping process that's being planned out, and it's even debatable as to whether or not this will happen in 2024. There's been some rumor that it might be pushed into 2025, but the fact is, again, the NBPP is putting this on the radar. We identified a problem. Here's what we're trying to do to fix that. So there will be fewer plan choices going forward, which hopefully will make the enrollment process easier. CMS estimated that there'll be a reduction of somewhere in the neighborhood of close to 20% of all active plans. So for those people who may be planning their next open enrollment period, I would suggest that you start analyzing your book of business and just be aware of what types of plans you have with which carriers and be prepared to react to that. It's another good reason to have a CRM, something to help manage your data. The other thing that I found was interesting, of course, we've talked a little bit about this already, was the NBPP also addresses the special enrollment periods for Medicaid redetermination. As you know, that kicked off a few months ago. We're right in the middle of that, where people who may have been granted Medicaid eligibility could be losing that Medicaid eligibility, and in the process may also lose their plan. So there was attention given to that. Another big issue was data matching issues, DMI, where people may be missing Social Securities. It was interesting because people who self-enroll, there was only a 4% error margin of missing Social Securities versus, say, a broker enrollment where there could have been closer to 40% missing Social Security numbers. These are stats I've read recently from CIO and CMS. So agents need to do a little better job of collecting the information up front, which is kind of leading up to this point of while we're having this podcast, the Consumer Consent Requirement Form. As you mentioned, this started June 18th, and primarily there's going to be 2 new requirements that are established from the Department of Health and Human Services and CMS, the Centers for Medicare and Medicaid Services. These requirements are, again, posted on our website already, but the impetus behind it is to create 2 things. One is to resolve consumer complaints, and the other is to resolve disputes between agents and consumers. Why would an agent have a dispute with a consumer? They're their customer, right? It's not necessarily the customer that they're having a dispute with. It's the fact that some unscrupulous agent has taken away their member, and now there's a conflict between the consumer and the original agent because they're calling to ask questions, and the original agent can't help them because they're not listed as the AOR. And that's usually when the uh-oh moment happens, and they discover, I need to do something to fix this. So then they call healthcare.gov, the marketplace. And in some cases, they're able to get that switched back, and the person that was the original agent is now named agent of record again. But I've also heard of situations where repeatedly that same member is losing to another agent. So because of that, there's a problem in our industry. This is what I'm going to just say is going to be the scope of appointment for the ACA. So I guess that begs the question, what is the new consumer consent documentation requirements? And agents are now going to be required to obtain and document consumer consent prior to assisting anyone on the federally funded exchange or through a state-based exchange where there's going to be an advanced premium tax credit or a cost-sharing reduction involved. Specifically, this documentation is going to have to be kept for 10 years. That's why I'm saying this feels a lot like a scope of appointment, and really we're headed that direction. What's happening in the world of Medicare Advantage oftentimes becomes a part of the protocol in the ACA. You have to keep in mind that it is being managed by the same government body, CMS, and the Department of Health and Human Services. Now, at first, when I read this, I thought, well, gosh, this is going to be easy. You know, whether you use Health Sherpa or some other web-based entity or platform to do your quoting and enrolling, there's a button that you just click, and it basically allows for the consumer to give consent to the agent, which I felt like was going to be adequate to meet these new requirements. But upon further review, as I'm studying through some of the the model consent form, as it's known, which that model consent form is on our website for people to use, it's going to require several specific things. Specifically, this will have the description of the scope, the purpose, and duration of the consent provided by the consumer or their authorized representative. So that's not necessarily new, but now it has to be more formally documented. The date the consent was given, the name of the consumer or their authorized representative, the name of the broker, the agent, the web broker, or any other agency being granted consent, the process through which the consumer or their authorized representative may rescind that consent. So that's new. And then, of course, the 10-year rule on how long you have to save these things. So now that also begs the question, well, in the Medicare world, we have the ability to collect scope of appointments by email, by text, by voice signature, paper. All these ways, no matter what it is that you choose to do, you have a way by which to save those things in the world of Medicare Advantage. And now, what are we going to do in the world of the ACA? If there's only this documentation that comes in the paper format, does that mean the agents are going to have to create their own consent form? That's where we're trying to seek further guidance. I feel like over the next couple of months, there'll be more private market solutions from companies like Health Sherpa that will clearly outline how this is going to be measured to help protect the agent of record as well as to help the agent of record remain compliant. As I was reading through the 2-page model consent form, I found it, and I quote here, it says, "This model consent form will not supersede any state agent of record, broker of record, or other form required by a qualified health plan." And it goes on to give the purpose of the form as well as to name those specific things that I just outlined a minute ago. But my recommendation at this point is that as an upline from the Brokerage Inc. to our marketing partners, that you utilize either the model consent form, which has a control number and a date and everything posted on our website. That's actually from CMS. That will probably be your best bet until we seek further guidance and that guidance that has been received comes through. Otherwise, you can try to do your own homegrown form, but my guess is you probably need to go back to what CMS says. This is the model consent form. And if you go back into like 2007, 2008, in that time frame in which the scope of appointment was originally designed, you'll see that CMS did have a model scope of appointment form. It didn't have any carrier logo. It was just the recommended form. And some of our agents use that same generic scope of appointment form even today. Well, this is no different. You can go and use the same CMS model consent form, put your agency logo on there, your name, identify who you are, go ahead and pre-fill in some of those required things I mentioned about the name of the agent of record or your agency. And then you could even make it a fillable format to put in the consent date, the date of rescission of that consent, all those things I just listed. It's not going to be as difficult as we think, but because this is a new requirement, one of the things that I've always prided ourselves here at the brokerage for doing is to provide the most up-to-date knowledge to keep our agents compliant so that they're not having to defend themselves, but instead they're out being aggressive about marketing in a compliant manner. That's what this podcast and this message is exactly designed to do today.
So to find the form, everyone, the way you get there is you log into our agent portal, the broker link. Right on your dashboard, you're going to see ACA resources. And if you click that, you'll see that tile for CMS consent form. So again, that's go to our portal, click ACA resources, and you'll see CMS consent form. You can download it right there. We'll link to it in the podcast description as well. Now, Mike, as you just hinted at, if you're techie, you may already be using things like DocuSign anyway in your day-to-day business. Or maybe you're good at using Adobe. There's all kinds of ways you can make a PDF fillable. So whatever your current process is, you can plug this right in and it would pretty much be effortless. And like you said, you could text it, email it, same way. You're sitting down with somebody, you could do it there in person, just write it out. It's a little bit of a nuisance, but if you are from the Medicare world, this is nothing.
No. This should be old hat for everybody else. And one last thought. I mean, there's a few things we're trying to do here to protect consumers with their personally identifiable information, their PII. Obviously, the PHI comes into play as well, but because it's a guarantee issue environment, there's really not any health questions that need to be answered. But these agents that are out there, the rogue agents that are taking business in a manner that's quite frankly stealing, it's ridiculous. And I've talked to a lot of our friends who are competitors across the United States and asked them how bad of a problem is this for their office. And pretty much everyone has the same issues. And we're all trying to clean up our shop so that if we self-police ourselves, there'll be less regulations. And as long as we're doing right by the consumers, I think that we should be okay. There's one other thing I'll mention about this. And when you're issued a hyperlink that you're used to, quote, enroll someone that's Health Sherpa or whatever, the other thing CMS has noticed is that these hyperlinks that are embedded with your own NPN are being used by multiple people. And so what this is also going to do is address that so that if any given time a person's logged in, there cannot be another person logged in using the same link. And that's going to come back down to the technology vendors or carriers to make sure that they're policing that. But simply put, that just means that if I'm the agent and I have a staff of 5 people, that I can't just send my link out and let all the people that are not licensed, not certified, not appointed, get on the phone with prospects or customers and try to help them enroll in a plan without being licensed, appointed, and certified. So as I look at this and I say to myself, on one side, it's a capitalistic free society, and I want there to be freedoms of business to not be riddled with excess expense. But at the same time, on the other hand, I look at this and say there's a counterbalance here because we do have an industry problem. This is a reasonable answer to that problem. Is it the precursor of more things to come? And I suppose the answer to that lies in the marketing behavior of the marketplace over the next year. And if the agents continue to do things to pilfer one another's business, then we will continue to see more regulations addressed at this. Otherwise, what we have said here today applies as of Sunday, June 18th, and agents need to begin to consider their business practices and adopt these new strategies right away.
Yeah, so to wrap it up, everyone, if you really think about everything Mike said, improving networks, simplifying choices, right? Making sure that people put their Social Security on their application, making sure that they actually want you to be their broker. None of this is really all that outrageous. If anything, it just improves the marketplace, strengthens it, increases the trust with the consumer as well. So we're always here to help you all. As Mike said, we want to be on top of these issues. Again, the way you find the consent form is right there on the broker link, ACA, and it'll say CMS consent form. That's all you have to do. You can download it right there. Mike, anything else to wrap it up?
No, as far as new business here, no. I do also want to just take the opportunity anytime we have a format like this to thank our marketing partners and really appreciate their efforts because it's, without them, we don't exist. And if there's anything that we can do to help support their marketing efforts or if there are compliance questions, we're more than just a shop that pushes products. I want to focus on services, and hopefully by listening to this podcast, we've done someone a service by helping them from getting into some unintentional consequences there and remaining compliant. So thanks to our listeners and our marketing partners for paying attention to this message.
All right. Thanks, everyone.